Hi guys, my name is Caitlin Policastro. I'm the Clinical Director at New York Center for Innovative Medicine. So today we're going to be talking a little bit about a therapy that is extremely innovative, new, fantastic, and simple to use. We call it Stellar Therapy. The other name is Stellar Delux Electronic Gem Therapy. So we're just going to break it down simplistically so people have a better understanding of why we use it and how we use it. So first off, the Stellar encompasses using something called chromotherapy. So chromotherapy is something that uses visible spectrum of light and gemstones and crystals that alters physical, emotional, and mental well-being or health of a patient in a positive way. So again, chromotherapy using that visible spectrum, or what people call colored light, can alter those frequencies. Remember, colors are all vibratory. A lot of things around us are vibratory, as are colors. So each of the color photons has its own wavelength or waveform and frequency. So that information, that vibratory information, that waveform or frequency, then gets processed or pushed to the patient, and the patient's body should recognize how to or what to do with that, how to utilize that properly. So that's the first part of this. So if you ever come to the center and you are lucky enough to experience this wonderful treatment, you'll see us using specific color filters. There's a slew of them. So this one specifically that I'm going to be showing you guys is an orange color filter. So this goes directly on top of this little almost saucer looking thing that will go onto the transducer lamp, which we'll talk about in a second. So you place it right on top of where the gemstones are inside and crystals, and that's what creates that color vibration or that waveform. So like we just explained, the next part of this or piece of this is using the transducer lamp. So that's these two guys that are right behind me. It's usually a total of 2 to 3 that we use on patients. So the deluxe transducer lamps, they basically run off of a dielectric resonance. So all that means in simplistic terms is basically you're transmitting the energy or frequency, that resonance or that specific vibration, from the machine through the transducer lamp. So it's carrying that information through the lamps. This goes on the lamp, the gemstones, crystals, and color filter, and that gets transmitted to the patient. So it's kind of encompassing all of those things. So the chromotherapy is the color filter. You have the information or quality from the gemstones and the crystals as well. And then you allow that energetic frequency or force that goes through the transducer lamps to carry that information to the patient. So a lot of people ask us what the Stellar is focusing or working on. So the Stellar can be used for many, many different things, acute, chronic, you name it, whether that's anti-inflammatory, regeneration, it can be used for infections, many, many other things. But a lot of our patients that come to us, we use it more so for something called an assemblage point. This point is also known as life force. Think of it that way. That's an easy way to explain it. So there's this life force or assemblage point. It's a cluster of energy lines that's around your heart chakra. Your heart chakra is generally right around CV18 here. So this cluster of energy lines around the heart chakra, it's thought to be where both our what we call physical and energetic bodies intersect. So it's kind of it's a big deal. It's where a lot of things can basically retain proper energetic form or function. So disease states have found to sometimes more often than not, change this assemblage point, right? So if you have a misaligned lower location, so it's not here where it should be, so it's a little bit lower, let's say in the right upper quadrant, or a little bit lower than that, kind of by the liver area. It's like a descending entry angle. That can be seen a lot in people who have chronic fatigue, if they have depression, maybe some neurological dysfunction or deficits like dementia and Alzheimer's. So that's lower. And then the exact opposite can be said for people who have anxiety, hyperactivity, panic attacks, things like that. So it's above the assemblage point. So regardless, if it's that assemblage point is not where it should be in this area, you're going to have some type of either, like I mentioned, disease state or physical malfunction. That's where the Stellar comes in. So again, depending on what's going on with the patient and where their assemblage point is, you use a specific program on the Stellar to essentially bring that back up. So the vibrations, the vibratory quality of the gems, the crystals, the transducer lamps, and the machine itself it's going to create this proper energetic flow or circuitry to allow the assemblage point to stay where it needs to be. When you have, again, a proper assemblage point at CV18, you have proper vital force, energetic function, and energetic flow. So again, Stellar, it's super easy to use. I'm going to show you guys in a clip after this shortly how to use it. It's non-invasive. It's about anywhere from a 20 to 40 minute therapy per program. And it not only helps with that I just mentioned the assemblage point, but it also helps quite a bit with any acute or chronic situations. And usually with Stellar, you need anywhere from, depending on the patient, obviously, 4 treatments to 10, 12 treatments, because it does need to be fairly consistently done. But it's fantastic. The results that we've seen are fantastic, especially in combination with our treatments. And that is everything that you need to know about the Stellar therapy.
So this is the actual Stellar machine, and as you can see, we have the transducer lamp that is already plugged into the machine as well. So really quickly, the basic premise behind this is, again, via our evaluation, we always test patients to see exactly what they need, but just for a general explanation for this video. So what we do is we turn the machine on. I already have the correct color filtration. As you can see, it's a little bit of an orange tint. So what we have is we're going to be using the orange color filtration, diamonds and carnelians in here. So that's why it has that orange tint, as you can see on my hand here. So the purpose of that is you want to do a little bit of more of a stimulating quality, diamond and carnelian, as well as paired with something like an orange filtration. That's what you're going to be looking at. We also want to be doing an alpha frequency. Alpha frequency, again, has a specific stimulatory quality, and as you can see, numbers, when you're going through the different preset lamp frequencies, they change in terms of the voltage or the hertz frequencies that you're giving the patient. So alpha is a little bit higher, like I mentioned, because we want to stimulate. All this is about stimulation. And a program that we normally see for this, for example, is something like Thymus Stimulation. So we'll be using it on the patient's chest. You find direct placement near CV. Usually it's about 18, 17, 18, and it's going to help with immune function. You hit a timer, you leave the patient for about 20 minutes, and that's everything.